Hello and welcome. Jesse Cannone here from LoseTheBackPain.com and Live Pain Free with another monthly audio interview. And today I'm really excited to be speaking with Friedemann Schaub, Dr. Friedemann Schaub, who is the creator of the Fear and Anxiety Solution. And we're going to be talking about how fear and anxiety manifests physically in our bodies to create pain, illness, disease, and more. So, Dr. Schaub, thank you so much for taking time out of your schedule to speak with me.
Oh, thank you very much for having me.
So, you've been doing this for a long time. It seems like you've accumulated, obviously, lots of wisdom and experience and knowledge. But before we kind of jump into talking about, anxiety and fear, can you talk briefly about what led you to this field? Maybe just a kind of brief, bio. A little bit of your background?
Sure. Well, I started out as a physician in cardiology and basically worked in a large university hospital in Germany and found that very quickly there is a lot of stress and anxiety with people that have cardiovascular diseases. Well, that's no surprise, but what was a little disconcerting for me is how little we actually were able to do for those people. We really could focus more on the physical problems and the physical symptoms, but the patients were pretty much left alone with their anxiety and with their worries, and especially after having some problem with their hearts or having a stroke that in itself caused a lot of worries and concerns. We couldn't really help those people. We didn't have time. We didn't have the means. We didn't have really the knowledge. What came next for me in my life was that I switched gears and I took a hiatus where I really wanted to delve into more basic research, understand more how the cells are working, how our body is working. And so I became a molecular biologist. I studied at the University of Washington in Seattle, and was very curious to find out what medicine actually doesn't tell us, which is that we do have enormous healing potential inside of us. I mean, what really blew me away is how every single cell in our body seems to be smarter than the thousands of researchers that try to figure out how they work. And so for a long time, I was just really involved in the mysteries of how our body is able to change, adapt, heal, and ultimately really keep itself well. And then I was wondering naturally, what is actually the relationship between our emotions and our thoughts with how our body works? Is there a connection? Is there like an overriding consciousness that says, this is basically what creates harmony and healing inside of us. And this is how I became very interested in the mind-body connection, especially in the subconscious mind, that non-intellectual part of our mind, and focused then on one of the biggest problems when it comes to health and well-being in our society, fear and anxiety, because fear and anxiety is really the epidemic in our times, and it has so much to do with also the physical challenges people are facing. I mean, some studies say 70% of doctor visits are due to stress and anxiety related challenges. So how can we use our mind-body connection to accelerate the emotional, but also the physical healing by addressing fear and anxiety? That became then, after this kind of windy road of my career, my focus for the last 15 plus years. And so that's how I created the Fear and Anxiety Solution, what my book and my work is all about.
Well, thank you for that. That was a great introduction. So I just want to emphasize one of the points you made. You had said that some research suggests 70% of all doctor visits are due to anxiety or stress-related factors. And what's interesting about that is I think that there's probably even more that is related to, fear, anxiety, and stress, but it's just not recognized that way because so many doctors are not like yourself, and they don't understand the impact of they don't truly understand the impact of emotional stress and feelings and beliefs and things like that on the physical body, and so they will often misdiagnose people, and not recognize that what's really the major factor for that person is a stress kind of based issue.
Absolutely. I completely agree with you. And I think that's, is something that I actually experienced firsthand when I was in cardiology, because my boss at that time, he was not a believer that stress and anxiety have anything to do with the development of a cardiovascular disease, which nowadays I think most researchers would agree is actually a major factor. Just when we know now more what happens with oxidative stress, cholesterol increase, high blood pressure, all those things that can be caused by anxiety, by stress, they certainly have a very, very driving factor when it comes to heart diseases and also other cardiovascular issues.
Yeah, it's so true. In fact, I've just come to realize in the past couple years myself the same fact that fear, anxiety, stress, negative beliefs and emotions trapped in our body are the number one cause of all disease or poor health. And what I've realized is you can have somebody who's doing everything right in all other areas. So they could be eating healthy, they could be taking the right supplements, they could be doing the physical therapy that they need, they can be exercising, stretching, so on. They could be doing all those things right, yet still not experience improvement in their health, or even continue to deteriorate simply based on their state of mind.
Yeah,
and,
absolutely.
What's really striking is why, and maybe I could ask you this as a question: why do you believe so few people understand the effect, the true powerful effect of stress, in our lives, and the effect it has on our bodies?
Well, I think this is there are 2 or 3 factors to this. One of them is that stress really became such a normal part of our lives that it's not even recognized necessarily as something out of the ordinary or something that needs to be changed. When we think about how much more busy we all are, how much more on the go we are, how we are not letting our mind rest at all. I mean, in the good old days when I was a child, we had 2 TV stations that ended at 10 o'clock at night, and that's it. Nowadays, 24/7, 200 TV stations or more are bombarding you with information while you're sleeping, because many people are actually leaving the TV on, or you can go to the internet. I mean, when we were young, there was no internet, there was no browsing, there was no Facebook. People have so much information that sinks in that our mind is so preoccupied and naturally goes in a kind of stress mode that it's normal for us to be on that level. And so stress is more accepted than it used to be. Now, the other reason is, especially when it comes more to the cousin of stress, when it comes to anxiety, people are very uncomfortable with anxiety because it's misinterpreted as a weakness, as a flaw, as a disorder. And so they don't really necessarily want to admit it to themselves. So there is this shoving their emotions through underneath that proverbial rug, or they ask for a very quick fix with some kind of medication that is supposed to ease the emotion, but it's not really addressed. And I think these are 2 factors that we really have to change. We have to understand that our mind, just like our body, needs some rest, needs some time to be able to unwind, and that we need to understand more how to deal with our emotions rather than suppress them. Because let's face it, when we go through life, the meaning of life is largely based upon how we feel and not on what we do or what we think. And so just trying to suppress our emotions is actually trying to suppress our experience of life, because at the end we just become functioning robots and we are not really living a fulfilling existence.
Yeah, so true. I was going to mention, and I've mentioned this before in other interviews when we've talked about stress and lifestyle. I have some Amish friends and in Pennsylvania, and whenever I visit them, I'm always reminded of how much less stress they have in their lives. And
Mm-hmm.
as you said, obviously there's no internet. They're not using the internet. They don't have power other than a small generator that's used for like just the refrigerator and a single light. But what I realized in actually spending quite a bit of time with them, staying with them on their farm and so on, is they work hard, but when their work is done, they rest. And
Mm-hmm.
so,
Mm-hmm.
we would do, let's say we would do some work in the field, in the fields, and it might be a couple hours, 2, 3 hours. We would have lunch, and then we would take a rest. And so it would be like an hour or two long rest after lunch. And then they would do their evening, afternoon chores, a couple out, maybe 2 hours of worth of work. And then they would prepare dinner, and then they would rest. And
Yeah.
there was lots of downtime. I mean, I suspected, my first experience there was like, oh, a farming life is tough. You're going to be working all day. Not really. As a family, they would work a couple hours in the morning, a couple hours in the afternoon, and that's it. The rest of the time is spent kind of either together as a family or alone, kind of rejuvenating, whether you're reading a book or you're just sitting outside, in a chair or on the hammock or whatever. And so and that's now, like that's happening nowadays. So when you said earlier about, when you were a child, I think back, if you were to think back even further in time, the further you go back, it seems the less stress there was. Not that there wasn't stress. There was obviously stresses, and they were probably different based on, the period in history. But now the amount of stress seems, as you said, kind of overwhelming for many people.
Well, absolutely, but you can also see, like, how Amish people are looked at as complete outsiders of society, which,
Right.
is part of, also how they dress and certainly how they move around in life. But I think their lifestyle, or in general, the more simple lifestyle, is something very desirable, but at the same time, also something that so many people have a hard time to even imagine.
Mm-hmm.
We did take tours with groups of people to Egypt, and Egypt is certainly, especially in the rural areas, very simple. There is not a lot of internet connection or TV watching or anything like that, and it took people often, 3, 4 days to ease in to
Mm-hmm.
this more slower way of living, because before it was just so uncomfortable to not be constantly connected, in touch, and it was just almost as if part of their identity was taken away, and now they were facing themselves in a way that they were not really used to. And I think we just have to overthink a little bit how we are going about life. Is it really about keeping up and basically always staying available and connected, whether it's for our company that we are working or for our friends that we feel like we need to be in touch with? Or is it actually time to really refocus on ourselves and really notice, okay, what does actually my body tell me? Does my body really want to go at 5:15 in the morning to a spinning class, or does my body maybe want to just stay in bed a little bit longer and relax? Do I
Right.
really need to watch the news with my cup of coffee, or would it be better just to close my eyes and maybe visualize my day or just do some breathing? Our
Mm-hmm.
body talks to us. Our mind is constantly communicating what it wants and what it needs in order to create a sense of harmony inside, but we are not listening. And
Yeah.
that's why stress and anxiety are such a problem, because we're not paying attention.
Oh, that's such a great point, and I just had an insight as you were describing that. We we are societally conditioned as we grow up to suppress our feelings. I'm reading a great book right now. It's called Wake Up by Sam Harris. Maybe you're
Hmm.
familiar with it, Spirituality Without Religion. It's very interesting, and he goes into a lot of detail about the science of the brain, the two sides, and
Right.
what each side does, and all that. One of the interesting things that it, it talks about is how one part of your brain, if you only had that one part of your brain, you would do only what you wanted to do, only what felt right.
Hmm.
But you have
Hmm.
the other part of your brain which takes into consideration other people's feelings and other external factors, and the two sides work together, and that's how we're kind of civilized. Um,
Hmm.
but
Hmm.
what's interesting, I was just thinking as you were describing that, is it seems from a very early age we are taught, um, you know, whether intentionally or unintentionally, to in many ways, not do what we want to do. I mean, if you think about, I have children, and so, I can think about, when my child is doing something I don't, want them to be doing, or I don't think they should be doing, and you think about how many times you experienced that as a child, no, don't do that, don't do this, and instead,
Hmm.
and so I think as we develop and as we age, we are kind of pounded with this, no, you can't do that right now, and you're always kind of doing what either the parent thinks you need to be doing, or the teacher thinks you need to be doing, and so we get used to not really making our own choices. And I know a lot of people struggle in their lives because they need somebody to lead them, and without somebody leading them, they kind of flounder around. Um,
Hmm. Hmm. Well, it's interesting because, I'm writing right now a book about survival patterns and how we are actually spending most of our lives, at least most people do, spend their times in survival. And what that means is that we are actually driven more by those, anxieties about fitting in or going
mhm,
through life unharmed or not getting judged or criticized than we are really living from a place of joy and purpose.
mhm,
And those patterns can be, for example, the pattern of pleasing. And pleasing can be, the wanting to make sure everybody is fine, being the one that always gives and never says no. Another survival pattern is the overachieving, and so many people can identify with that, where it basically is all about how much can I really accomplish, what goals do I need to reach in order to somehow feel safe or secure within myself. I mean, I know so many people that tell me that on the weekends they are working because when they are not working, they feel completely useless and they don't know what to do with themselves. So they get quote unquote bored, but they get uncomfortable. And so that survival pattern of overachieving and always having to be productive drives them also into a constant living with stress and anxiety. And then there are the people that are the avoiders that just want to hide out and just feel like it's better to be invisible and not to engage than, having any kind of danger or some uncomfortable situations to deal with. And then the fourth one are the controllers. And those are the people that the least believe that they are driven by actual survival and by anxiety because they feel like, I'm in control, I'm in charge. But if anything happens, what they don't control, they get into that deep feeling of powerlessness, which they respond often with anger or with frustration or trying to again be the authority. So all of those patterns, I think, most listeners can identify with. When those patterns run your life, when you feel that basically you cannot really let go of control, or you cannot get out of your comfort zone, or it's hard for you to say no, or it's difficult for you after you have succeeded with one thing not to always think about the next goal that needs to be reached. If you know that these patterns drive you, you know that anxiety drives you. And then you know that you're out of harmony with yourself and you're not living from a place of purpose or passion or joy. And then it's time for you to rethink your approach to life and make some adjustments.
Yeah, that's so great. And what's interesting too is I think a lot of people, including myself up until just a few years ago, don't really know or understand what anxiety, for instance, really is. I did about a year or so ago. I did a 3-day, 3-night camping trip by myself in Big Bend, Texas. Um, I was the only person in the Texas Big Bend State Park, not the national park. I was the only person camping there, and it's like a 55 or 65,000 acre, um, just completely wild campground.
Uh-huh.
It took 45 minutes just from the ranger station on a really dangerous and almost undrivable 4-wheel drive road to get to the campsite. And so it
Mm.
was very remote, and I was by myself. And the purpose of this was kind of like a pre-Vision Quest Vision Quest. So
Mm-hmm.
I'm planning to do a Vision Quest, and I wanted to kind of do a little mini version of it myself to kind of get myself ready. And what I realized is I felt very uncomfortable within the first couple hours.
Mm-hmm.
So I unpacked
Mm-hmm.
my gear, I got, my wood ready for my campfire, and I sat there and I sat for about an hour, and after about an hour I started to feel uncomfortable. At
Mm-hmm.
first I described it as bored, as you said earlier in our conversation, but what I realized is it's not bored, it's more what you had said also is uncomfortable. It's
Right.
feeling uncomfortable with just being and just resting. And so, I'm kind of the control type or the overachiever type, and I
Mm-hmm.
noticed that in my time there, and so I think everybody, I think the majority of the population has some level or some form of anxiety, but they are so busy, quote unquote, living their lives that they don't even realize they have it. And
Mm.
one thing I've noticed, as I'm getting older, and the men around me, my age and slightly older, I've had several people I know, men, 45 to 55 years old, have anxiety attacks, and they they never knew they had anxiety. They never thought they had anxiety. In almost every case, they thought they were having heart attacks, and
Right.
they went to the hospital. And of course, the doctors don't know what they're doing, and so they couldn't figure it out. And so then finally, they went to a natural doctor, and they kind of figured out that it was stress and anxiety. And I think that's one of the biggest challenges with it. Like you said, not only does it have uh, what's the word I'm looking for? It has a reputation that it doesn't really deserve.
Mm-hmm.
That kind of makes people kind of shy away from it. But also, I think people just don't understand it. So, could you kind of give your best description of what is anxiety?
Well, it's obviously there are different ways to look at anxiety. We can look at it from the perspective of the neurotransmitters that are cruising in our brain. We can look at it from the perspective of the brain itself and the anxiety triggers that basically are, or the anxiety switch, which is called the amygdala, which is in the midbrain, that has been very well studied as one root cause for anxiety. Or what I find a more empowering approach, we can look at it from the mind perspective, because we really cannot change our brain so easily, or maneuver around our neurotransmitters, but we can certainly change our mind and learn more about our mind. And in that regard, we have to really deal with the subconscious mind, because as we all know, it doesn't really make sense when we feel anxious. We do feel anxious sometimes at the most unopportune moments, at times where we should actually be calm and centered, and that's when we get a panic attack. Or we wake up in the morning and all of a sudden we feel like, oh my God, something really bad going to happen, but everything is fine. Nothing really is imminent, putting us in danger. So it's not a logical thing feeling anxiety. It's really illogical, irrational, and this is why it's so hard for us to talk ourselves out of anxiety. You know, how many people say, oh, I shouldn't feel worried, everything is fine, but that's just not enough. You know,
Right.
it doesn't really touch the emotion, and the emotions do come from that deeper part of the mind, the subconscious. Now, the subconscious is such a rich aspect of our consciousness because it really is responsible for so many different aspects of our life. You know, memories are held in the subconscious, beliefs, automatic patterns, of course, the emotions. Lots of our physiology is actually regulated subconsciously. I mean, some studies said that about 75 to 80% of our daily activities are run by our subconscious mind. And then you can imagine if we are really so hung up with our intellect and identify ourselves so much with our intellect, we are actually overlooking these 80% inside of us that pretty much are responsible for how our life is going and how we are approaching it. Now, when it comes to anxiety, anxiety is not a disorder and it's not a flaw and it's not a weakness. It's a natural emotion. It's something that we unfortunately have not learned accustomed to deal with because nobody really explains to us when you're anxious what to do.
Right.
We know other sensations. You know, when we feel hungry, we eat. When we feel tired, we sleep. When we feel there is an itch, we scratch. But when we are anxious, we go into a mode of feeling overwhelmed, powerless, and all we want is just to get away from the feeling as soon as possible.
Right.
But there are root causes. And what I'm focusing on with people is to understand what is actually the root cause for your anxiety patterns. And I say patterns because when we do have anxiety, it's not an isolated event. Most people know that there are certain triggers that cause them to feel anxious, and then they are responding with certain anxiety patterns to those triggers. For example, if you would call yourself shy, every time you go into a social setting, you don't know people, you haven't met them before, since you are 10 years old, you go into the corner and you just have your little glass of whatever and basically hide out. That may be your anxiety pattern. You feel so uncomfortable until you finally can go home.
Right.
Or, there may be the anxiety pattern, as we said before, of the person who is constantly scanning everyone around to make sure that they are pleased and approving of you and that you don't really feel like you're saying anything wrong and you're becoming even the chameleon to really fit in. So these patterns are learned and they start somewhere early in our lives. And usually they have three root causes. And what I mean with that is that on a subconscious level, there are three drivers that make this anxiety pattern continue even decades after they started. One of them are unresolved emotions, unresolved memories where we just experienced maybe rejection over and over again, or we experienced neglect, or we just experienced that, well, our sibling was a troublemaker and always got in a fight with the parents. So you choose to be the good one, the good girl, the good boy, and always do everything right. And that's, if you're not, you feel anxious because then you feel like, oh, now I'm becoming like my brother or my sister and get in trouble. So these unresolved memories and emotions certainly are like the fuel for the anxiety patterns. And then it's interesting that you mentioned that with the brain studies, then there are parts of the subconscious mind that are opposing each other, similar to what you just described. There is a part in the subconscious mind that may feel like I want to do what I want to do, I want to move forward with purpose. That's a part that's rather confident and maybe positive and optimistic. And then there is the inner protector that says, no, you need to be more, focused on keeping yourself safe, small, controlling, pleasing. So the survival pattern and the purpose pattern, these two parts are often in conflict with each other. And anyone who is really chronically dealing with anxiety knows that they want to do something that makes them feel better. They want to move on. They want to get out of their comfort zone. Something holds them back. Something is pulling them back. Maybe it's negative self-talk that they're hearing. Maybe it's just a feeling of doom that stops them in the tracks. So that's a second subconscious root cause, these inner conflicts. And the third one is how we see ourselves. And that's very, very important to really understand. If you have a limiting core belief inside of yourself that you are fundamentally not good enough, or believe that the world is not safe or people cannot be trusted, you may not even be aware that this belief is there and creating kind of how you perceive your reality or how you perceive your life. But that limiting core belief runs most of your decisions. That limiting core belief is what you see when you look in the mirror, what you see in other people around you. And all those three factors are basically the roots of the anxiety. And when you understand them and you address them, you can actually literally not only heal your anxiety, you can outgrow it.
Yeah, well, what's interesting is on the last one you mentioned, how you see yourself. I think for a lot of people, including myself, until just recently, I never knew, like I lived my whole life without realizing that I had a negative belief about myself. And it wasn't until, I don't know, maybe 8 or so years ago when I did something called a Vision Day with one of my coaches, Rob Berkeley, and he asked a series of questions. And one of the questions was 0 to 100%, how much do you feel you deserve blank? And so it was, how much do you feel you deserve wealth, health, respect, et cetera. And then he came to love, and I was like, ugh, and I felt like somebody punched me in my stomach. And I was like, oh no, what's that? And that's when I realized that I had a negative self-belief, but I had never known it was there. But like you said, all along it was influencing my behaviors in my life, and I didn't even realize it. And so I think that happens for a lot of people, unless I'm rare, and it doesn't seem I'm that rare.
No.
But it seems like a lot of people don't realize they have these limiting beliefs, those behaviors. Like you said, the person who goes into the corner of the room and tries to kind of blend in, and so nobody notices them. That person that probably who's doing that doesn't realize that it's anxiety driven. They just think, like you said, they just think that they're shy. And so I think that the awareness, for a lot of people is like the first step, and probably the most critical step, because unless you have the awareness, you are not likely inclined to actually take any actions to work on the healing process and the improvement, if you will.
Well, I think that step and accepting that this is not something they need to feel bad about, because I think part of the problem with with, for example, seeing oneself as shy or not deserving is that this becomes your identity. And then you feel like there is something wrong with you and you're just fundamentally flawed, and accepting that you actually can, and this brings me back to the power of each and every cell. Well, our consciousness, our mind is equally powerful. We can actually outgrow and change those beliefs and those identities. Just we need to know, what angle to take and what are the leverage to move these old encrusted patterns. But, this doesn't, again, work with just pure intellectual understanding. And I think you understand what I mean with this, but ultimately the path to healing when it comes to anxiety needs to go through the heart. You need to find self-compassion. You need to find self-appreciation. You need to redefine what it means to actually love yourself. And these are things that, of course, nobody really necessarily thinks about when they're anxious, because all they think about when they're anxious is to stop the feeling.
Right. Like you said, run away from it, distract themselves.
Yeah,
Escape
exactly.
it. So
yeah.
before we shift gears and talk more about kind of like you said the path to healing, I would I would like you to maybe briefly talk about all the different, because I think many people, again, as we said at the start of the conversation, many people don't understand what anxiety is. Hopefully, from our conversation today, everybody listening has a better understanding of what anxiety is. Hopefully they have a better awareness within themselves where they might be behaving in that way with those types of patterns as you described. But three, I don't think people fully realize how powerful an impact the stress, fear, and anxiety can have. So can you rattle off maybe some of the different types of health conditions that you've seen that are primarily caused by fear, anxiety, stress, and can go away, and can be healed and can disappear through dealing with the fear and the anxiety and the stress?
Yeah, I mean, it's. I think when we deal with fear and anxiety, it is a very strong and powerful force within. And what happens is that on a physiological level, we do release stress hormones, and those stress hormones, cortisol, adrenaline, these stress hormones are really pushing our system into the sympathetic nervous system part, which is basically the fight and flight or freeze response, which is all about survival. So everything which is about digesting or growing or healing is kind of ignored from our system, because we are in that fight or flight or survival mode, and there is no time to go into the parasympathetic response. And that explains a lot what the physiological outcomes or the physiological side effects of fear and anxiety can be. So one of them is certainly that people have a very hard time sleeping. Now, you may not see this as a physiological side effect, but it is, because when we are not getting enough sleep and enough rest, our body just stays tense. Our body is not really going into this healing mode, and naturally our muscles start tensing up and become more pain. We are more prone to any kind of colds or infections simply because our immune system is really suppressed by the constant being in the stress mode. Often people with chronic anxiety develop stomach pains, which often has also to do with, an increase in release of stomach acid, but also the indigestions, the IBS, the irritable bowel syndrome, certainly something that's often associated with stress and anxiety, where just our digestive system is not really functioning in harmony, because it is really not the focus again of the body to digest in that moment. It's more to fight, run away, or to hide out. And then autoimmune diseases, something I find very fascinating, because in some ways you could say that our body is actually mirroring back to us often what we are really dealing with on a more mental, emotional level. And autoimmune diseases are ultimately where your own immune system is attacking the healthy tissue of your body. And what I have often seen with people that have been stressed and anxious for a long time, that they do develop autoimmune diseases like Crohn's disease, colitis. I had a client that actually had an inflammation of her esophagus, of her swallow tube, and she wasn't able to swallow anymore because of that autoimmune disease. And then I find also, I mentioned the cardiovascular diseases, of course, before, but I also find that in general, the breakdown of our immune system through constant stress and anxiety can heighten the risk of cancer. And so it's a major concern that we really need to address and deal with.
Well, I think you had mentioned inflammation there, describing the woman with the esophagus and the difficulty swallowing. And one of the things that it seems to be the case as well is the constant state of stress, fear and anxiety creates a chronic inflammation in the body, and
Yes.
that chronic inflammation then goes and causes all sorts of problems. And many studies have been done documenting over 30, at least over 31 disease, quote unquote, diseases that are caused by inflammation. Some of them autoimmune, as you mentioned. So you've got 30 plus diseases that are tied directly back to inflammation. Inflammation, it's and this is what's interesting from my perspective. People are trying to deal with physical health issues physically, and so they've got a condition. They symptomatically treat it. Obviously, that doesn't work. They may even try to physically treat it, the cause. Oh, well, you've got inflammation. You need an anti-inflammatory, and that may help. But even that, very likely, is still symptomatic. Again, while beneficial, it's still symptomatic treatment if the bigger cause of the initial inflammation is the chronic stress, fear, and anxiety.
Absolutely. When my father got really ill, and my mother was a few months later diagnosed with cancer, I developed the most painful sciatic pain that anyone can imagine. I mean, I was flying back to Germany to see my parents, and I wasn't able to sit in the plane. I had to literally kneel on the seat and walk around because sitting was as if a knife was pushed into my behind. It was just really, really horrible. And I knew that this has something to do with the stress about, the prospect of losing my parents. And what was interesting, though, they lived in Germany. I lived in Seattle. What was interesting, the moment I was there and I was actually able to help, and I was able to stay at night with my father and helping to get up, and I could comfort my mother, the pain went away. It was really this, finally I was able to actually be there for them, which made that pain ease. Even though I was very active, I felt more in harmony than in that paralyzing feeling of not being able to do something, being so far away, having some guilt about it, all of those things that are stress factors that certainly made that pain in the body occur. So that was a really impressive, for me, also personal mind-body connection that showed itself there.
Yeah, that's a perfect example. You went from fear, right? Fear.
Sure, absolutely.
Fear of loss, and then in that moment of caring for them, you went to loving and giving, and not fear, and so I mean, that's a perfect example. I mean, it's really amazing how powerful the mind is, and one of the things I've seen, excuse me, in all the years that we've worked with people with various types of back, neck, sciatic pain, fibromyalgia, etc., arthritis, is, and I alluded to it earlier, is people will they'll do everything right and they'll make progress, but they'll still say there's still this 20 or 30% that's lingering. The pain just won't go away completely. And when you probe and you kind of probe into it, the one thing they've not really dealt with is the mind and the emotions. And it seems like that's the biggest factor. And I'm sure you've probably heard of the studies that have been done. I forget the doctor's name, but it was a doctor in Japan who did studies on food and plants, and how the emotion and the energy that was projected, at the food or at the plant affected its health, if you will. And it's so silly to assume that we aren't affected by that energy as human beings when all these other species of plants and even food is affected by that, feelings and energy.
Yeah, I mean, it makes complete sense that we are more affected because our thoughts create a response, physiological response. And he basically talks more about the energy that is emitted when you have a certain negative thought and
Right.
that energy is affecting the water or the plants or the rice or whatever he was investigating. And it's Dr. Emoto, and I have to say, I was always skeptical, being a researcher, but I had a client who actually copied his experiment. And in his experiment, he has some white rice, cooked rice, and one dish exactly the same rice, from the same batch. One dish is basically, surrounded with loving words and kindness, and the other dish is surrounded with negativity, gets yelled at, insulted, and one dish stays after days and days and days white, and the other one turns completely black and moldy. And when my client showed me this experience, her experiment that she just copied, I was convinced this was quite impressive and certainly something that really should open our eyes.
Yeah, and it's so interesting because it's so simple. And it's so exciting, I should say, and interesting because it's so simple. It is a lot easier. Well, not necessarily easy, but I think it's easier and obviously much safer than ingesting all sorts of drugs or, even natural supplements, many of which probably aren't needed. And what's really needed is some mind repair, if you will.
Yes.
People will do physical therapy, and they'll do, I guess some people will do kind of counseling type therapy, but much of that is not even, in my opinion, optimal for the healing. As you said, the healing has to be through the heart, and I'm familiar with lots of the different types of therapies that you are certified in and teach. And so maybe for just a minute, can you talk about in your experience what you feel the most effective approach, kind of healing approach is?
I think this is not something that we can just generalize because everyone has different blocks that block them from approaching themselves and ultimately, going to a deeper level. So I work with neurolinguistic programming, with clinical hypnotherapy, timeline therapy. I have developed my own methods, but I find these are more the bridges or the keys to really help people to connect to their subconscious. What I find is more important is for people to actually understand themselves more and then be empowered to work with themselves. In my work, there's certainly in the sessions with clients a lot of healing and you could call it cleanup of the past happening. But equally important is that people have tools in their hands where on a daily basis they can continue to shift away from stress into harmony, where they know what to do when there is a mind racing happening, when they know what to do when there is a certain sense of discomfort inside of them. Empowering people and giving them the tools to really know how to handle their minds, just like, we educate people on how to eat well and how to exercise, correctly. We need to educate people how to work with the mind and how to embrace their emotions. And that's equally important to any kind of methods that are out there, because ultimately you need to have your personal relationship with yourself.
Yeah.
And some methods will work well, some methods will not. So you're going to find your own mix, just collect and then see what works.
That's so great. In fact, it's the same approach that I teach people with back and neck pain. And they're always, not always, many people are often disappointed because they want that magic fix.
I know, yeah.
But what we teach is the same thing: is the causes that are keeping you in pain may be different from the next person. And so for you it might be 70% fear, anxiety, and stress, and 20% compression of your spine, and then whatever. And so it's always a mix. And so just as you said, it's the same with in my belief, it's the same with healing and trying to improve anything. It's always a combination of factors. The key is, as you said, identifying what those factors are, and then also identifying what is the best treatment or remedy or healing practice for each of those factors or causes?
What was interesting about your story with being 3 days out in the wilderness, that I think it really captures in a nutshell the problem that we have with fear and anxiety. Because in that moment when you were out there and you felt that discomfort, and I think a lot of people can probably relate to that, everything that you were holding on to, what you felt, just familiar with and maybe identified yourself, was gone. So basically you were facing yourself in that moment, in that remote environment. And the anxiety actually, that's what I see more and more. And it becomes very clear when you work with people that move from anxiety actually into a greater sense of self-empowerment. The anxiety is actually not telling us that there is something externally wrong. This is what we think. And this is where, of course, evolutionary, that was that purpose to warn us if there was a snake, a spider, or a saber-toothed tiger out there. But that's not necessarily what we are dealing with. Now, when we are dealing with anxiety, usually it tells us how much you're really connected with yourself, how much you feel centered within yourself. And the further you are away from yourself, what can, for example, you take other people more important than yourself, you identify yourself with projects rather with really who you are or what you desire, you give your power away by always, doing things that are expected from you. All of those things move you away from yourself. And the anxiety ultimately tells you, I see it more like a faithful friend or an inner GPS system. Are you actually in your, let's call it truth? Or are you kind of, outside living kind of, on a path that is not yours? And what's so beautiful about it, when we are spending time with anxiety and we are really understanding what makes us feel not anxious but at peace, it really points exactly in this direction. It points towards yourself. And this is why the healing of anxiety is not the absence of anxiety, but the healing of anxiety is actually that sense of being at home with yourself, that sense of, as I said, self-love and appreciation, true confidence and trust in yourself. That's really what happens when you listen to the anxiety, because that's what the anxiety is ultimately trying to tell you.
Yeah, that was such a great, thank you for that. That was such a great description of kind of what's going on, and it really resonated with me. So hopefully everybody listening has found it helpful as well. Well, this has been a great conversation. I really appreciate it. So for anybody who'd like to learn more about Dr. Schaub and his work, again, his program is called The Fear and Anxiety Solution. His website is www.thefearandanxietysolution.com, all spelled out. He has wonderful programs, books, audios, videos on his website, just tons of great material available and very helpful. And I'd like to thank you, Dr. Schaub, because I really appreciate you sharing with myself and my listeners.
Thank you. What a great conversation. And I really, really enjoyed the time. And I hope the listeners got some good insights and hopefully also some motivation to work on themselves in this regard.
Yeah, no, this was wonderful, truly valuable. Thank you again.
You're so welcome. Thank you.